So adjustments, and I tell people this, and I tell my patients this, especially if I have patients who have not been under chiropractic care, I'll say it's actually safer to adjust a baby because of the amount of loud, gentle force we're putting in than it is to adjust an adult. Like the process is safer. We use about 4 to 6 ounces of pressure, and I tell my students, when you think, especially the cranium, do not think about moving cranial bones. I'm not taking a child's head and deciding, oh, this cranial bone needs to go over here, or this one needs to go over here. That's not what we're doing.